First of all, let me introduce myself. My name is Raul Salas. I'm an orthodontist here working with Nemotec. And on today's webinar, we will be showing, right, the full process of getting to know the aligner therapy in office. And we will begin now. Okay, so can you please just confirm to me if you can hear me properly and visualize my screen? Right now, you should be looking at a flyer for the next Congress we're going to have on aligners. It's going to be at the Congress Palace in Salamanca, Spain. You can use the questions panel to tell me if you can see me properly, and also you can use the questions panel to write any questions you have along the way while we're um, continuing with the work today. Okay. That's the confirmation, and thank you. Okay. Thank you, Dr. Susan, and thank you, Dr. Tatiana. Okay, so let us begin with our class today. Let me get out of the presentation right here. Okay, and let's go with our case. Give me just one small second. Okay, just 1 second more, please. Great. So, first of all, let's talk about a little bit about diagnosis. Okay, as you can see right here, I have let me export this just a little bit for future references. This is an extra thing you can do with Nemocast when you have already planned for a case, right? You can export the full timeline like I have right here. Okay, and in the settings icon on the timeline, I'm going to place it right here and send it to the desktop just so we can have it later and import it as well. Okay, so first of all, let's get rid of our current setup right here. Okay, and let's begin assessing our treatment. Okay, so your treatments, right, in with liner therapy should be. My screen disappeared. Okay, thank you. Can you please tell me if you're seeing it again right now? Awesome. Thank you, Dr. Tatiana, for pointing that out. Okay, so well, just so you know, while on the timeline, what I did was go to the settings down here, right, and export the existing timeline. Um, I'll show you how to import it later, but let's start with our diagnosis of the case. So what you should do normally in every case, right? You should take into account all the variables that you would do with normal orthopedic, or sorry, orthodontic therapeutic, right? So most of the times we tend to overlook some how can I say this, aspects, right, of the normal orthodontic treatment, because we think that we will somehow manage to place aligners easier, right, than doing a normal treatment. We tend to think of aligners as magical instruments. So the first step to notice, right, is that we are going to have to treat every case like it's a normal orthodontic treatment. So I mean, it's not bad to point it out, because most people tend to forget that part. Okay, so let's start with our case. Normally, right, if you're just going to use the orthodontics, sorry, I'm a little out of place because I forgot I had to do this. Okay, normally if you're only going to use STLs for the case, right, you have some information. Obviously, you should try and and use it, right, with the x-rays and everything. But sometimes, like in this case, right, since we have a tomography of the patient, we can actually visualize the root, right, of the case. We can visualize the skull of the patient, right. Here we're obviously taking a look at a class 1 patient, some by protrusion, not much, but you know, a very orthodontic case, with some, sorry, let me just get like that, with some by protrusion, not really something important. And also another diagnostic procedure that I like to use in my cases is the addition of a picture. I'm going to show you how to add the picture if you don't know how to. And normally when you're using NemoCast, you will have two modules: ortho models and preparation, which is black colored, and orthodontic diagnosis and planning, which is red colored, right? So in any point of the preparation, right, so during the importation, the orientation or anything, you can create, let me go to the basis right here of the models. Okay, so during every step of the preparation, you can use this icon up here, which is align the 3D with the photos, right, and upload a photo of your patient. Let me get rid of the mask and everything, right? So you can use a photo, an existing photo already loaded into the records of the patient, right, to mark points in the model and on the smile of the patient, right? We should get or try to get at least the exact same points that we're going to use in both of them to get a good alignment. And this is going to help us with the diagnostic part of our treatment. Okay, I'm going to show you what I mean. So let me just get right here the position, right? Okay, and as soon as we mark, we need at least 4, but you can do more, right? Depending on how big the smile of the patient is, you can use more points to visualize everything and do the alignment. What this is going to do is it's going to show, right, a projection of the 3D model onto the picture that you're using. When you visualize that everything is correct, right, you can keep going. In this particular case, as you can see, I have a little bit of a rotation, right? The outer contour of the teeth is not placed correctly, so I can always cancel it and try to do it a little bit more to our liking. So move a point around. If it worsens, then you can move it the other way around, right? Like that. And once we get a better fit, like in this case, we're already in a better position, okay? Then we can draw the inner lip contour. This is going to be point by point. Always remember to go in a counterclockwise fashion, okay? Select the corner right there. Make sure as well to not remove more than what you actually need to, okay? Select the corner point right here and finish up where we started, okay? You can adjust the points as you see fit when you're done, okay? And create a new mask. What this is going to do is it creates a window in the picture, right, with the aligner placed in the actual position for the smile of the patient. And when we go to planning our setup, this is going to prove useful and helpful to align the true smile of the patient, kind of a DSD stuff, but for orthodontic projections. Okay, so when we go to the teeth, actually now we have this icon right here. We can actually, show the picture, and we will be able to see the projection of the smile of the patient. We have some corrections right here, right, that we can apply, right? Some colors we can move around just to show different types of oh, sorry, I deleted the mask. And we can get around to showing, a better projection of the smile with shadows or without shadows, depending on what you want. Okay, this particular case, the lighting is very good, so we really don't need the shadows, but you can see right here, we're actually visualizing the teeth correctly. Okay, and all of this is going to be helpful more than actually planning with just the STLs. Let me just get a sip of water. This is going to be very useful while working with our case, because now we have the full information of the patient and we can visualize it real time. So for example, if we activate the picture right here, these are all tools that we can actually use for the diagnostics. We can activate the purple lines right here as a reference, get a reference for the philtrum, right? We can visualize that there is not really concerning deviation of the midline. We actually have the tip of the nose, the Cupid's arch, everything in place, okay? Uh, would you show us again how to visualize initial and final setup? What do you mean, Dr. Tatiana, with initial and final setup? the already completed timeline. Okay, yeah. Well, we'll get to that a little bit later, so don't worry about it. I mean, I will show you where that is. So don't worry. I will get that. But since we have a more or less a tight schedule, because we're going to do a full setup together, so don't worry. I'll show it to you. Just if I tend to forget, I always at the end um, give some room for questions, and if I forget that or if it's not clear, please write it to me again. So as I was telling you, now we have full information of the bone, right? And we can start with the diagnostics of the bone and the smile, and we can start the diagnosis. Okay. So again, like with every, let me just open a Word document right here. As with every case, right, we have to make a list of problems that we have to solve. What are the expectations for the case? Okay, so first of all, we have no concern about the midlines. Maybe center the upper midline to the lower one. Okay, so that's something we would like to visualize. Okay, so center upper midline to the lower one. Okay, that's our first problem. We can visualize we are at almost class 1 on our right side, and on our left side we are a little bit better with the occlusion. Okay, so no changes in the class molar class and canine class. So that's not a list of problems. Okay, we can visualize, for example, we have an upper occlusal plane relatively flat, right? To the occlusal plane, we obviously have some canting of the occlusal plane. We have the right. Okay, so would it be proper to correct it? So we can actually take a look at the picture, right? And as we can see, we could use a little bit of correction. We'll try to include it. Okay, so let's, sorry, Google Chrome, no, add to our list of problems. Upper occlusal cant correction on the left side. Okay, that's our next list of problems. Okay, on the lower one, we have, aside from the crowding, a little bit of speed curvature, especially for the canting. So let's say lower arch speed curvature. Okay, solution, get it flat. Okay, and now let's take a look at our crowding. Okay, so we have the upper arch. We can see we don't have that much crowding, but up here you can use the panels, right, to show the upper and lower discrepancies. So when you just activate the upper discrepancy, you see here we don't have any measurements, right? We only have the ideal measurements and the fact that we are, struggling with the space. Okay, so right now it says a spacing of -7.8 and -7.2. That's because we don't have the third molars. Okay, but in order to show the final correction or the final measurements, right, we have to utilize the guides. The arch guides are going to be our allies, right? So when you just load the type of guide that you want, we normally select a normal one, right? you can see that now the measurements start appearing on our specific arch, right? So this is now going to help us to navigate through the actual spacing, right? Diagnosis. Okay. So, well, first of all, what I like to do is set up the guides. Normally, what I would do is decide, right? First of all, which arch we're going to treat, but we already loaded the upper one. Let's just give it some shape, and what we can do, right, as well, is adjust it to our catered needs. Okay, so let's say we're just going to place it, right? You can, whatever you click a specific point, right, you can get the arch to form a little bit better, and we can now use this arch perimeter to visualize our differences in spaces, right? So you can see right here, for example, in the upper right central incisors, the measurement is 9.2 millimeters. Okay, the normal measurement will be 9.2 plus minus 3. Okay, on the lateral incisors, we have a little bigger lateral incisors than we should. The differences in this is 0.3 because we have the spacing, and that's going to add up to the crowding that we have. So we already have zero point 0.3. Okay, at the end of the second segment we have 1.3. That accounts to 1.6 millimeters, and actually the second molar, right, is a little bit smaller than it should be, so this accounts for us. And this is the important part. We already have 1.3 need of spacing on our right side, okay? But because we don't have the third molar, it's counting us as minus 10. So what we have to do is these 10 millimeters, right? Take them into account and get rid of them. So at the end, we will be right with need for space. This negative number, which would be the spacing of the third molar, right, minus the 1.3. Oh, sorry, the all this symmetry leaves us with 9 millimeters of space. That's with distalizing the molars, but we actually want to maintain the class 1. So what we're going to do is subtract the 1.3 need for the hemi arch to well, first of all, subtract the 10 millimeters from here. We have one sorry, the 10.3, which is the symmetry, right, of the posterior. So get rid of this, right, cancel it out, and we are left with 1.3 millimeters of sorry, discrepancy on this side. And on our right side, we are left again doing the symmetry. We have 0.7 plus 1.7, that accounts for 2.4. Okay, cancel out this negative crowding because we don't have this space right here, and we're left, you know, when we cancel these two out, with 2.4. So 1.3 plus 2.4, we have almost 4 millimeters of crowding on the upper, okay, in order to get this teeth, right? So first attack. So on the upper, we are left with 3.7, I believe, millimeters crowding upper. Okay, once we have this guide right here, we can click on load the lower. Okay, this is important. Normally this will be activated by default when you start with the case. Okay, so because this is activated by default, we have to deactivate it because otherwise it's going to load both arches at the same time. It's a little bit troublesome to work like that. I honestly feel it easier to me like this. So we're going to load the lower and reposition it. It's going to give us a nice, oriented guide right here. Okay, and again we can go with the lower discrepancy and do our sum. So again, we're going to do the same. We have 0.3 on the mi arch, right? We're going to go to, when do we do the symmetry, 0.3 plus 1.5, that means 1.8, 2 millimeters, right, of spacing. And we're going to go with of crowding. So 2 millimeters on one side, and we have 0.6, and now this is not taking very good into account. Okay, so 0.6. This canine is a little bit smaller, but we can add the differences. So 0.4, 8 and 6, 12. Okay, plus 0.6. It's again 1.8, so 2 millimeters. So we have 4 millimeters total on the lower crowding. Okay, so now we have the full tools to start planning this case. To plan, well, the curve of speed, the flat curvature of speed, we could add maybe 0.5 millimeters, right, to correct one side with the other, just to be sure. So 4.5. Okay, and we can now start deciding what we want to do with the case. Where are we going to get that space up? So you might think, hey, I want to do some expansion, and that will get rid of the full crowding, right? We can get some IPR, but let's, since we have the tomography right here, let's test our theories. So what I'm going to do right here, okay, it's again, now that I have right here, I actually like this plane of the curvature of speed right there. Okay, I need to lay it flat, okay, in order to have a comparison on one side to the other. Okay, I actually can shift if I want to keep the occlusal cant, right? I can shift it in the first form, but let's lay it flat first. Okay, and because we have the tomography again, so we can use the setup views button right here, up here, right? Instead of being in the setup view, go to the orthogonals view layout and start by visualizing how much we can get of expansion on the lower arch, because that's going to be necessary. So when talking about the tools, we are already finishing with the diagnostic procedures, right, to visualize if we're going to do the IPR or not, right? What I like to do first of all is visualize obviously the lower arch, which is going to dictate how much expansion we're going to be able to make for our case, right? I mean, with a normal case like this one, where there is no discrepancy between the bones. Okay, give me just 1 second right here. Okay, great. So when we get the selected tooth right here, we can select it directly from the odontogram or directly in the STL mesh. Okay, you can see we have the highlighted controller, and these are some of the tools that we are used to move, right, the tooth. With the grade tracker, right, you have a center fixed point at the center of the clinical crown, which will allow us to perform movements in the three directions of space, right? But we can also use the blue tracker right here to perform linear movements. So a combination of X and Y axis, right? And rotation, but the center of the crosshair is the pivot point for the rotations. Whereas when we're working with the grade tracker, the center of the pivot of rotations is going to be the center of the clinical crown. So that's the two uses that we can get. So for example, if I am to get right my lower arch correctly, right? I'm still trying to visualize how much expansion I'm going to be able to make. We're already load or try to load an actual guide. So what I would normally do, right, is then go to the spacing labels down here and activate them. And once they're activated, they're going to tell me exactly sorry, let's just wait for them. They're going to tell me exactly how much space am I needing to perform a specific movement. So you can see right here, blue numbers mean there is a little bit of spacing. The line means neutral contact, and red numbers will mean will mean that we have collision, which would result in IPR at the end of the treatment. So what I would do first, right, is select a good rotation for this molar. In this particular case, it looks very good. Okay, select the tooth, change the tracker. The 2D tracker is already activated down here, but change the tracker. And let's see how much space I can get, or I can visualize virtually right here for the lower arch expansion, mainly trying to reach towards zero. Okay, so down here I can select, for example, the center of the mass of the full tooth to simulate the rotation and try to get right to towards zero. We can visualize it right here. Okay, maybe just a little bit less. So let's go back a little bit like that. Okay, and as you can see right here, because I'm moving it in a two-dimensional place, I actually distalize it a little bit, right, and make the collision, but I can always correct that part. Okay, so let me just get rid. Okay, and sometimes, right, just so you are familiar with it, this number is still in red, but you can see there is a blue square. That still means space. When the collision is complete, right, we can actually see a full red circle. So if the outer part of the square is red, right, then that means you still have sorry, that is blue, and that means still spacing. Okay, so let's go with the premolars on this side. Okay, again, selected, change the tracker, and when there is a curvature on the actual tooth, like this one, like so, okay, sometimes you will not be able to visualize correctly the curvature, right? Because if I keep going, then I can see the full tooth, but because of the curvature, I'm not able to visualize it centered. So when you're using the tomography like this, you can also hold down the O key on the keyboard, right? And actually change the direction in which we are visualizing the tomography, right? Let's once done the rotation, right, try and visualize it on the full axis of the tooth, and now you can see how much bone I actually have on this side in order to try and work my way to torque 0. Okay, so let's again do, okay, my inclination to achieve torque 0, and you can see right here we already have a better projection of how my arch is going to look, right? I actually can, for example, try and do different rotations, right? And let's not forget I'm not yet done with the tracking, okay? Sorry, with the tipping. I'm just trying to get out of the way as many variables as possible first, okay? And let's do the same with our first premolar. There. Okay, again, let's visualize the full position, and you can see right when we are achieving this side, I actually have a little bit less bone to work with. Okay, we're very close to the cortical. If I want to achieve torque 0 a little bit more, I actually can go to the cuspid right here, okay, and torque it inwards, okay, in order to achieve a good occlusion, and that's already giving us what we can expect in terms of spacing inside the bone for this side. Sometimes you might actually visualize, right, a situation in which you might be able to or sorry, you won't be able to expand anything, but you need it. And as you're working with this, you get to make a different diagnosis. For example, maybe a bone graft with gingival tissue, like with corticotomies to make it better. So all of this is as we go. Okay, but at least on this side, we already have a line of occlusion that we can maintain. Let's go to the other side, and this time let's do it a little bit more quickly. Okay, so you already know the basis right here. Let's visualize it like that. Go where our molar is, okay, and again grab it, right? Let's try to go to torque 0. Oh, sorry, I forgot the rotations. Okay, so first of all, let's get the rotation out of the way. Well, it actually looks good, so let's go with torque 0 first of all, just to get as much expansion as we possibly can. Okay, so there we go. Let's do the same with our premolar. So get the rotation right in place like that, following the established arch that we already trying to do. Okay, like that. Let's place it a little bit better like this. Okay, and again, let's go. Try to get to torque 0 right there. Okay, visualize it. If we're a little bit short on the expansion, we can always try to do a little bit more, obviously taking into account the bone. So this one actually, we could place it a little bit better like that. Okay, and move it like so. Okay, take a look at what we're doing right here. It's not too much of damage, so we're still okay. Okay, let's go here, visualize the first premolar, right? Okay, get the rotation, right? Get a good view on the bone right here. Okay, select it again. We can actually do more or less the same change. Okay, so let's try and select our portion of the crown, sorry. Perform the torque till we achieve a good occlusal position, right? And if we make this big, right, we can visualize better what we're doing. So you can see right here on the fourth premolar, right, we still have or we could still have a little bit more of torque in order to achieve it, right? But I'm actually, you know, visualizing and somewhat bettering the position, so that's going to be okay. And now we can actually start planning our full setup. Okay, so we know for a fact that this is the most expansion we can get out of the lower arch. And if we go to the incisors, right, and visualize them here on the, let me get this straighten up, right? If we visualize them on the tomography, we can see that we really don't have that much room to go either outwards, you know, protrusion, or to retrude them. We could change a little bit the torque, but that would mean more space, and we have to take that into account. So finally, to get a full line of work, right, we need to adjust this line, right, to our actual parameters. So we cannot go further on the posterior segments, and we cannot go um, protrusive wise outer than our incisors. Okay, so we know for a fact that the lower incisors are the ones that I'm going to keep. So I place the center of the parabola, right, moving the line on the center incisors. We already established we want to keep this curve of speed as much as possible. I can actually, you know, change it a little bit like this. Give me just 1 second. Okay, I can actually, you know, place it a little bit more like that. So we want to maintain this flat. The incisors are going to be kept here, okay, and the posterior segments I need to constrict a little bit, right, in order to fit them correctly into the arch form. Okay, you can see the arch form is a little bit rougher on the edges. Okay, we can actually change some details about this. I'll just get this right here. Okay, so we can just fine tune the line so we actually get a very good segment right here. Okay, and this is going to be our parameter to make sure we don't get we don't get into trouble. So you can see right here we're already needing some IPR on the lower one, but the most important part of this is okay, we already have our lower guide, and we can redo, right, or reposition our upper guide in order to fit the curve of speed of the occlusal plane, right? This is going to give us a good height for our incisors, a good occlusal plane right here, right? That we can actually change the guide a little bit, and this guide, it will also help to guide the smile arch. As you can see right here, if I were to follow it, it's consonant to the lower lip. So this is all the required tools in the diagnostic of the case that we need. Next up, right, we just have to take care of our needs for space. Okay, so I know that as long as I maintain myself within the parameters, nothing is going to go wrong right here. Okay, so I can now example, okay, sorry, let me just get it right here. I can start visualizing the oblique ridges of the teeth of the teeth, yeah, to fit correctly. Okay, I can, as long as I keep inside my already established therapeutic line. Okay, I know for a fact that I'm not going to have or run into trouble. We can change the tipping according to our needs, to the root parallelism that we need, right? For example, like that. That's going to give us some space. Okay, we can do the same thing on the other side, right? And for example, I know that ideally I wanted to create right some sort of the occlusal canting correction. So we can start now visualizing if it's going to be possible maintaining the actual therapeutic, or if it's too much. For example, if I want to go all the way up here and I'm already visualizing, hey, this is going to take a lot, then I can start visualizing if it's going to be useful for my treatment or not, right? So if I'm going to be able to perform it like I want to. Okay, so give me just 1 second, please. Okay, so well, then let's take a look at the anterior segment, and we can go on the posterior. As you can see right here, I already took care, right, of some spacing issues, right? We have or we had, right? That's going to be useful for us. We're already creating some space, and now actually I need this side to be a little bit more constricted because we have a difference. So whenever that happens, you can also select the symmetry or deselect the symmetry in this case, right, and constrict the arch a little bit more on one specific side or the other. If we move the guides, don't worry, we can always create them again. This is going to be better for me to not go out of bounds. Okay, because I moved the upper, I have to reposition it. Okay, let's again do the same procedure, right, like this. Okay, and once you're finished with the guides, I forgot to mention, you can lock them in place up here. Okay, so from this point onward, our treatment is going to be fairly simple. So we already have our limits, right? Our boundaries. Okay, so what's left for me to do is start moving the teeth, right, to best fit the actual position in which I want them to be. So let's start doing that portion in particular. Okay, and I'm going to take care of the spacing needs, right, once I have the full setup. Okay, so I'm already creating some space right here for my lateral incisor, right? I can change the different views, use the different trackers. Obviously, that's going to be a collision that I'm going to have to take care of when the tipping calls for it. Okay, so let's do it like that. Okay, let's maintain our incisor, and you're going to witness when I'm finally done with this part of the setup. Right here. Okay, like that. Let's get rid of the dipping issues. Okay, make it a little flatter. Great. Make it like that. Okay, and now I can distribute my spacings. Let me just get the torque right on this one. Okay, so I can now start distributing my spaces however I need them. Okay, so first of all, let's not forget we have to maintain the lower midline. Okay, we can distribute the space between my lateral incisor and my canine right here. We have a spacing issue. This is a lot of IPR, so I can distribute it to the posteriors if I want more, a little bit more wiggle room. Okay, and finally, right, as you can see right here, I'm actually I'm winding up with my original calculation for the spacing needs. Let me just get rid of this tipping issue right here. Okay, that's better parallelism. Okay, and actually we can go with a little bit less torque on this one, just so we can make it perfect. Right, like so. Okay, and if we sum up the sum of our parts right here, so we have 0.5. This 0.1 needs, right? Sometimes if I look at them and I don't see a really good collision, for example, here it does look like it needs 0.1, but here it's more like a friction, so this one I won't take it to account. but we have, aside from the expansion, we already have, 0.7 millimeters, 0.9, 1.1, 1.2, 1.4, and 1.5. So we expanded more or less 2 millimeters, and the rest is distributed to the actual arch. And that's how the prior planning, allowed me to create my needs for space. If I want to, I can always redistribute the spaces, right? For example, if I don't want to perform, right, this big IPR, right, I can always make them closer like this, distribute the spaces a little bit better, right, for my arch to fit. And when I'm done with this, right, if I hide the gingival mesh and activate the mandible, I can actually see if I'm inside of bounds or out of bounds, right, depending on what I need. For example, my canines could benefit from a little bit more negative torque, right? So I can always come back right here, okay? Select a position, and this is actually going to help a little bit with the spacing needed of the setup, right? Make it better inside the bone. Let's do the same with the lower one. Okay, but as you can see, just by following the line that I already planned, I actually got a very good setup, right, for this patient, respecting the biological boundaries that the bone gives us, right? Okay, and making a little bit more space for our teeth. Okay, so that's one way in which we can do the therapeutic. If you're actually not concerned about the midline too much, I could distribute the spaces better right inside of the, let's try to do this one a little bit better as well. Okay, so that's working good. And this is all going to account to how I want to perform the treatment as well. Okay, so that's going to be better at the end, right? And we still have the same spacings. We just redistributed everything into a better position, right? So this is going to help us achieve good therapeutic. Okay, great. Let's go to the upper arch, right? Here we have some challenges because we also need, well, first of all, the need for expansion, right? Because we expanded the lower arch. Okay, so we can again go back to our trusty, sorry, let me just do the upper, to our trusty tomographic slices, and for example, start by matching the expansion, right, and the occlusal from one side to the other, just so we achieve a particular occlusion right here. Let's go with our premolars, right? If I activate again the premolar area right here, I can again start changing my tips and torques, correcting the discrepancies, right? Okay, I can, and obviously always the spaces can be, managed, right? The spacing can be managed at the end because I already planned the case, right? So I just need to make it as best as possible. Let's go with the canine right here. Okay, I can actually start managing it the different way, like that. Okay, I can visualize it right here. Okay, I have good canine overjet. I have a little bit of tipping, so I could try and give it a little bit more occlusal room in order to fit correctly into the patient. You can see it's already starting to take shape. Let's go with our counter side right here. We go to our molar again, right? Select the best view. Okay, let's do the same. Try to get to torque 0 right here. Adjust the occlusion. Okay, let's go to our premolars. And if you can't find the lower premolar, like so, okay, we can, try feed it like that. Visualize if it's good. For example, here it's good, and correct the occlusal canting like so. Okay, let's go to our next premolar. Again, search for the where it matches, right, one side to the other. Correct this high occlusal point. Okay, you can see it start to take shape as well on the changes that I'm performing. And go to our canine. Let's take a look into the canine overjet, which would be right about here, and we have the same situation, so we can select, right, a better view, get it a little bit more room, trying to maintain torque 0, right, and you can visualize how it's already taking shape. So I'm just gonna go and intrude this canine a little bit to match the occlusal canting, or as much as possible, like that. Okay, and we're almost done with the therapeutic setup. What we need to do now is manage the spaces. Okay, so first let's take a look at our class 1 or 2. Okay, so actually this one fell into a better class 1. We have a little bit of collision, but since we're at second molar, I can always perform, right, some movements. For example, a good movement, since I'm expanding, right, I could take into consideration the expansion of this molar to constrict it a little bit and also distalize it enough so it doesn't create contact, right? And I'm already thinking about the timeline that let me finish quickly so we can start into the timeline. And this spacing created with the slight distalization, right, and the expansion is going to allow me to actually get a better class 1 relationship on the right side of the patient. Let's work with our tipping. Right now we are working the distalization right here. Okay, let's get rid of this like so. Okay, we have a little bit of space, right, to make sure this canine, which is already in a good position, gets to a better position on the occlusion. Okay, like so. We have spacing for our lateral incisor, which is going to be good. And let's go to the left side. Okay, again, I actually want with a better position. We have the same issue right here. The premolars are okay. Let's get rid of some tipping issues that might help us down the line. Okay, this side is good. Let's just get rid of this one. It's a little bit more expansion in order to fit correctly, right? You can get rid of this spacing right here. Okay, and at the same time, because I'm already expanding my molar, right, I can get rid of this issue right here. Okay, right there. And we already have our guides, right? After this, it's a matter of, well, taking into account the best position for our central incisors. For this particular case, if we want to center the midline, we're going to have to perform some IPR. Okay, and if we go to the 3D slices, right, I'm already seeing how much bone I have available for my central incisors. So for example, this one, I could, let me activate the lower ones so we can visualize. If I want to achieve, right, good overjet and good overbite, like so, I'm going to need to retract it, right? The inclination, the torque is good. We can do the same one for the other side. Okay, right? When I reach one on the other, we can actually visualize the spacing that I'm creating. If we want to center the midlines, I can center them like so. Okay, and let's finish up the setup, right, using only the 3D view. You can see right here that the need of space is very large, right, for even though I would have my lateral incisor placed. So the correction of the midline, even though I have a very good class 1 on both sides, it's not going to be quite good. So I will not be able to correct it completely, but I can start. Remember, we had some lateral incisor excess of dental mass, right? So let's place a good tip right here. Check the torque. Okay, torque is good, tip is good. We can actually distribute these spaces right here. Okay, let's go to the max, which would be 0.4, 0.5. Let's get a little bit more room right here between our incisors. Okay, follow our lines and distribute the same space out here. Okay, like that. Okay, and finally, right, we can take a look at our finished setup right here, right? And you can see the beginning, the end. Okay, now after that part, we're going to go maybe a little bit longer on today's session. It's okay because we have to, sorry, I was stretching out. We have to cover a specific part, which is taking the decisions on how to perform the timelines or the therapeutic. Okay, so we already have a setup. We already know what we have to do. We have some movements right here, which are red colored, which is with the red color indicates that those are slightly difficult movements, right? So let's take a look of what we have to do. Let's, before we go, just let me show you the bone. Okay, so that's what we are achieving with the setup. Okay, so let's go with our to our timeline, and let's take a look at what we're seeing right here. Let me just give me 1 second. Okay. Okay, so I know for a fact that I need a lot of IPR. Okay. First of all, right, let's take a look at how much crowding do I have and what is the normal sequence for this therapeutic. Okay, give me just 1 second. Give me just 1 second right here. Okay, sorry about that. And okay, let's follow the movements, and let's try to before we start separating them, right, down here in the timeline, let's take a look at what we're doing. Okay, so if we take a closer look, actually let me change to the setup view right here. Okay, so if we take a closer look at our upper arch, for example, let's get rid of as much visual noise as possible. What are we going to see? Okay, so we have the line, right, our arch guide. We have the initial step right here and the final step. Okay, so what did I do? Expansion and retrusion of the anterior segment. All of those movements are working in favor of my situation. However, right, I also have some intrusion, right, down here, which will prove a little bit challenging for my setup. So I can do two different scenarios. Either expand everything, right, because the distalization of my second molars, it goes with a little bit with the retrusion, so I don't worry too much about those, but I want you to take note, right, of I want you to take note of sorry, I got a little distracted right here. So this the second molars distalizations are not a movement that is very difficult to me, because I'm going to distalize what I'm expanding. Okay, the most difficult situation in this scenario is first creating space so I can perform correctly the IPR and get rid of the rotations of the upper in order to retract it as a full segment, and then do the intrusion. So that's more or less my line of thinking, because I want to expand and correct the torque first of all, right? Create the spacing and then intrude. So that's how we're going to approach the therapeutic for the upper arch. Let me change this right here because I want to show you something. When you're working with the Nemotec in the default settings, right? When you're working with the Nemocast, sorry, all the translation movements and the rotational movements are going to be grouped together, which means that mesial distal movements, protrusive retrusive movements, and intrusive or extrusive movements are going to be grouped together. So if we have mesialization with protrusion and intrusion, all of these are going to be in translation. And rotation, as you can see right here, refers to torque, tip, and pure rotation of the teeth. Down here, and this is where I was showing at the beginning, right? We have the settings of the timeline, in which we are going to give the instruction to Nemocast what is the limit of force that I will be able to exert before it shows an error, right? How much angles per aligner and how many millimeters per aligner, sorry, am I going to be able to place, right? Down here we have an automatic IPR, but I really don't use this option too much. I will show you later how to do it. And the division of the movements in components. Right here, when I have a finished timeline, I can import or export it however I see fit, right? And what I'm going to do right here is check the box of divide movements in components and click OK. What this is going to do is that now it will allow me to visualize, right, the different components I have for each tooth movement. Okay, so taking into account what I'm trying to do is well, if I'm going to try and perform a different treatment, sorry, in different stages, right? I will have to look at the full picture, right? At the big picture, first of all, and decide, okay, so for example, this is a fairly simple case. At the end, I don't have that many red movements, right? Or I don't have even a black colored movement that will represent something difficult to achieve. Okay, so but for example, let's say that I had a lot of crowding. Okay, first of all, so maybe if I have a lot of crowding, I will need to perform the stage, and like I'm going to tackle a normal orthodontic case. So normally in orthodontic cases, you have the derotations and leveling of the case first, and then you start working with sagittal movements or torques, right? Specific ones. So that's the situation we're going to follow right here. If I had a lot of crowding, I would perform a first stage, right? All we did right here, with as much expansion as possible, derotating everything first, get it into position, right? Then rescan the patient, start a new treatment, maybe with the vertical portion of it, right? The intrusion, if I was more inclined, maybe use even a TAT, right? Temporary anchorage device to intrude it as much as possible. And after that, then start dealing with the sagittal treatments. Okay, so maybe 5 aligners for the rotation and expansion, maybe 6 aligners more for the intrusion, and then this. But since we are watching, right, that this case can be achieved with a full aligner sequence right here, we can actually start taking into account our treatment. So for example, what I'm going to do on the upper right, let's take a look at this side, is I'm going to get expansion and torque on all these segments of the aligner, right? So I know for a fact that if I perform, right, let me get rid of this movement so you can visualize it better. Okay, so if I perform these two at the same time, I'm going to achieve, right, a good force on the aligner because I'm doing right 1 and 2 parts of the segment at the same time. So I'm going to keep it like that. Okay. Now, next up, right, I'm going to work with the uh, expansion, right, of the medial segment, and because this is the hardest part of the segment, I can place both premolars at the same time. Let's try and do both premolars at the same time. Okay, and afterwards, right, I'm going to start with expansion, derotation, right, and translation of my anterior segment. So more or less my timeline is going to look like this. Now let's go to the other side. And on the other side, actually let's make it larger, right? On the other side, I have more or less the same situation. Oh, sorry. I have more or less the same situations, right? So these aligners, right, are heavy on the protrusion, right? The sorry, I'll get rid of this later. Okay, so we have, right, a very hard expansion, right, a little bit more on this side, and we also have to deal with the intrusion. Okay, so maybe the 7, right, I can leave the intrusion on my molar, right? The intrusion is at 0.7 millimeters, so I wouldn't worry too much. But the real problem comes for the premolars. So here is where I'm going to change, right, the portion of this, perform both my premolars again at the same time. Okay. The intrusion, I'm going to leave it at the end of the treatment so I get it out of the way. And here's where you start doing your own biomechanical combinations depending on what you need. So for example, here I'm going to allow, right, I'm sorry, actually I can make them smaller, sorry. Okay, and because I'm not exceeding the actual threshold for the movements, right, I can go and do my thing. If I go past the movements, right, the permitted movements, it's going to turn red. So that's my cue to know what's happening. Okay, I'm going to get rid right here of the canine, which would be more or less like here. And if I want symmetry, then I can start, doing my canines at the same time. These are my incisors, okay? And let's exit this. So right now, I'm at a total of 25 aligners for the upper. That number is yet not definitive because we also have to, visualize the IPR, how it's going to happen. But let's take a look at what I'm doing right here. Okay, so I start with both the posterior arches, segment arches, right? At the same time. Then I perform my premolar expansion. Okay, then I start with my canines, which okay, this intrusive component is actually going to the mesial. That's something we have to take into account. Okay, and okay, so now that I have an overview of the timeline, I can actually start with the timeline overlaps, right? And what these are going to do is they're going to help me distribute the spaces. So for example, here I already see that if I want symmetry in the movements, I'm leaving behind stages that could be beneficial for it. Okay, so what I'm going to do is, okay, I'm going to start with movements of my canine. I have distalization, right? I have some intrusion, the change, right? So I start, getting this one in position. I can already start with some distalization of my lateral incisor. I can start right here using the rotation. The lingual movement, I'm going to leave it at the end. I can get the intrusion, right? The tipping correctly, the torque, or even the torque, leave it at the end. Okay, while I'm doing this, I can visualize what's going to happen to my central incisors. So if I'm going to the mesial, right, for example, that's going to get a need, right, for me to perform some IPR. Okay, so maybe the mesial movement I can leave it later. Start with some rotation, some lingualization of the incisor, right? Not all, but some lingualization of the incisor. And what I can do when I don't want to perform a full movement, for example, the full lingualization, I can just visualize right here. Okay, so up to this point, I don't have the need for all the contact. I could, however, get this rotation a little later, right? Just so I can match with the lingualization right here. Okay. Then this lingual portion, right? I could make it a little bit this different. And what I'm doing this is trying to manage the spaces so I don't have to perform IPR before all my rotations are in place. Okay, let's do both sides. Okay, let's do both sides right here, because for example these two are going to be, I'm going to need to perform them earlier, or actually get rid of them whatsoever. That's going to be useful as well. But let's focus on the canine. Okay, so what I'm going to do with my canine again is the same situation, right? Right when I'm finishing right here, start with this, and once I get the spacing necessary, I can start visualizing. Okay, for example, in order to, okay, the distalization for this canine, I'm not going to perform it until the movements on the canine are finalized, right? And I actually can pair them up with the retrusion of the anterior segment. And right here on my, okay, let me get rid of this, right? What can I do with my central incisor? Okay, I'm going to have to rotate it and do the intrusion, right? Some distalization at the same point, and finish up, right? Let me close a little bit with the retrusion in a segment. So what I can do right here is place all these retrusion at the same time, and what I'm going to achieve is try to make everything happen at the same time. Okay, so let's take a look at how these movements would work for the case. Again, let's remember, sometimes it will be better after I already finished the therapeutic, because for example the intrusion on this component, right, it's not going to help too much. But you can start visualizing right there. Okay, I need the IPR, but if I were to perform some IPR, for example, between my central incisor and lateral incisor right here, okay, that could prove a little bit detrimental. So what I can do is postpone the distalization, right? Get the intrusion a little bit out of the way first, and that would give me a better position to start the IPR later. And by this point, if I were to perform all the IPR I needed for the retrusion, right, everything is in a better position and will help me get through it. When we place the IPR on the timeline, nothing is going to change the meshes. So for example, if I activate the spacing labels right here, okay, so I'm not changing the quality of the mesh, right? Let me just get, for example, place, right click on the timeline, add IPR, and it will tell me between which teeth I am placing it. So between 13 and 12, right here, when I have a 0.1 contact, I'm going to place the full IPR because everything else is linear movement, okay? So before this, between, okay, so this is important to take note as well. Let's come up with a solution for this. And if we cannot find any other solution other than do a round tripping for this tooth, right? I can actually mid movement select the tooth in the timeline and do a little bit of protrusion maybe to get rid of the round tripping, right? And it will add all the necessary movements to perform this situation. And now afterwards, right, where the movement starts happening, right, I will have a better condition. Okay, so I actually can move the lingual situation right here a little bit later. Okay, and this will work far better, right? Okay, now let's be here between my incisors. The contact is acceptable. Okay, so I can place again the IPR 0.3. Okay. Down here between central and lateral incisor, again the contact is very good, so I can place it. Okay, down here the contact is starting to happen, so I can place it again. Okay, let's go with 0.3. And up here, right up until this point where the rotation actually happens and the need for space arises, then we will add our IPR. And what this is going to happen, right? What this is going to do is now it's giving you the instruction at the end of the treatment where you performed the change in the situation. Okay, so it doesn't change the mesh, but if we go, let me open this printer up right here. If we go to the setup, right, the setup summary, we're going to be presented with a full chart of the movements that we performed, and actually we will be able to visualize what is the toughest movement for a particular tooth, right? It's normal that when you're loading it, because it's loading the full information, it closes and then you reopen the printer icon and it will give you or display the movements because it's feeding off the actual setup that we created, right? And for example, our best our hardest movement right here on the incisor is the retrusion. The intrusion, or the extrusion on the lower portion, right, is the hardest part. So that's going to give us already an idea of how we are going to approach the attachment placing, which is the final part that we're going to perform right here. But also, if you were to print a PDF from this summary, right? Let's just place right MC because that's Masterclass, Clinic Masterclass, right? It will display and create a PDF where it will tell you the exact stages of the aligner treatment and what you need to perform from IPR at that particular stage. Okay, so at aligner number 18, we're to perform 0 0.3, 0 0.3, and 0 0.3, right, between these teeth. And at aligner 21, right, 3 aligners later, 0 0.4 between these teeth. Okay, so just so you know, what you put in the timeline, you can have it out printed in your clinic, so you don't forget the actual therapeutic you were performing for the patient. Okay, so this is how we're going to perform this part. Now, this is a full setup for the upper arch. I'm going to show you, right, what I meant with the export and import. Let's not, we don't have enough time to do the lower, but you get an idea of how you would perform it. And when you're happy with this timeline, but let's say that maybe you have to want to create a copy or a backup for some reason, down here, right, at the settings menu, you are going to be able to export the timeline into a specific folder, right? You just click on OK. And for example, this particular patient, I have the yesterday's class setup in which we did not correct the occlusal canting. Okay, so let's say I want to review both options in the same plan. Up here in plan, we can go to the gear settings right here, create a new plan. Okay, here we can put the name, so no cant, just so we know it, and activate it. Okay, when we close this window, we'll have the original position of the setup for this patient. Okay, so we have the original display, and if I go to the timeline, right, I can import the already exported document right here. In this case is this one, MC. Okay, it tells you that this action is going to move different scenario. I already have some attachments for that case. You can see right here. This is not the final position of the attachments because that changes, but you can see more or less right here what I did. And at the end of the treatment, right, we are presented with very similar options, but in this one we did not correct the occlusal canting, right? And on the one that we performed together today, we did. Okay, but that's you can see that there's virtually no difference because we planned it the same way. Okay, so now when we go to the attachment placing, then we have to start thinking what the plastic is going to do to allow me the movements. Okay, so let me get rid of the situation. Let's place the attachments on the upper arch. Okay, so I know for a fact that I'm distalizing a little bit and compressing a little bit the 7 right here. So normally if I'm just compressing, right, I wouldn't need an attachment, but since I already have a very compromised tipped position on this molar, right? And I'm going to distalize it. This molar could wind up intruding a little bit more because I'm already pressing outwards, well, inwards and distalwards, right? So it could intrude. So my best bet would be to have something to hold it in place, okay? To be able to control the movement. Sorry, let's get and let me delete this one. Right down here, place attachment, click on the plus sign and anchorage horizontal. Okay, so my best bet would be to have something that would allow me to control the rotation, but also the vertical aspect so it doesn't intrude too much. Okay, so with the right click, we can actually select how much or how big the attachment I want to place. Okay, like so. Okay, let's take a look at what am I going to do. Okay, so this molar I am protruding. I really don't have that much problem with it. Okay, because I'm not rotating too much, I'm not tipping too much, and actually positive torque is part of the natural movement because we're pushing outwards on this molar with the plastic. However, because we have already a situation right here, we need to add extra stiffness to these two. So one of these would be very welcome on this side because that way, okay, we are going to be able to add stiffness to the back of the aligner, right, as well as an anchor point in order to move these two. If I were to only expand these two, as you can see, there is not a lot of tipping and there's not a lot of rotation. If I were to place actually an anchor point at the next step, right, which would be the canine, now my force system would be supported, right? Let me mirror this right here. Okay, would be supported because as we were discussing, the hardest part of the aligner, right, is going to be mid segment. So I already made stiff the most far for the furthest part with the attachments. I just have some retention right here in this part because we don't have that much rotation. We could leave it like that. Okay, now let's go to our lateral incisor. Here we have some rotation. Remember, this is a round tooth, and we have retrusion. We could benefit from an attachment, right, that allows us to perform both. So, for example, semilunar attachment like this one, right? We have the rotation to the mesial. Okay, so normally we would have the flat surface to the distal, but we also want to help with the retrusion, so we can add a vertical component to it. We could have, however, and let's take a look at this, something like this because it holds a flat surface and a vertical surface, but most patients and most doctors do not like placing bigger attachments on anterior teeth, so you can have both options, right, for this one. Delete object. Here, let's remember that the retrusion was as well the position. Okay, this is a flat tooth. So, for example, 15 degrees of distal rotation is not going to be too much, but we can do follow the same recipe for this one. Okay, and this one could be like that. Again, we have to add our next corner point on the canine, even though we don't have very large movement, but we have to mirror, right, because of the same situation with the molars, we have to mirror our two attachment situation back here. Okay, so mirror the attachment, copy, right, align it as best as possible, okay, in order to make this part stiff. And because we are intruding this, right, this is where we're going to have to take a closer look at what we're doing. So whenever we're intruding, we need support teeth. Right here, we have enough support for the back, but if I wanted to add a little bit more support, even though I don't or I wouldn't need to, okay, I would have to add extra support to my lateral incisors, so that way the aligner can intrude, right, these two, and not dislodge or morph too much on the posterior segments, right? It's going to deliver the force accordingly, and that's how we were going to place our attachments right here. So up to this point, we finished with today's program. Up to this point, do you have any doubts? Okay, let's see. May I have a recording of the webinar? Yes, of course, the webinar is being recorded. I think you may be able to solicit the recording with your commercial agent. Yeah, that's how you will proceed about this, Dr. Tatiana. Does anyone else have another a doubt that you might want to check now that we're here? Okay, well then it's been my pleasure to be with you today. I hope to see you on the next one. Also, well, we have some upcoming master classes, right? Dr. Renan De Vita, my colleague, is going to perform the master class in TAT's design guide, right? Guided TAT placement, and I myself, I'm going to perform a master class in how to perform indirect bonding trays for your brackets, for your fixed appliance cases. I hope to see you all on the next one, and it's been my pleasure. Thank you.